Good afternoon, everybody. Welcome to our COVID-19 update for Eau Claire. We're glad you joined us again. It's a good opportunity to answer questions of the media, as well as spend some time walking through basic information about what's happening related to the COVID-19 pandemic in Eau Claire. Today is Thursday, March 25th. Again, thanks for joining us. I'll walk through, as we usually do, some basic data. We'll share a couple of updates, and then we will share some information for some of the questions that did come in advance from the media. If any of you have questions that you would like to ask of us in the media, please do put those in the chat box like usual, and Audrey will share those with me as we get to the end of our time. So our basic data for Eau Claire County, we are now at 11,202 individuals in Eau Claire County that have tested positive for COVID-19. 66 cases in the last 7 days is what has been reported on our website, if you are following that or tracking that. But that number has been impacted by data cleaning at a state level. Same issue that we've talked about for the last couple of weeks. The state is going through their process to look at the full and complex data set and really doing that data cleaning effort. This week, it's resulted actually in more positive cases overall. Those additional positives are from not recent cases. Those are older cases that were documented as either not in our county or documented previously as suspect case and are now in our county as confirmed cases. So overall an increase, but it is not for this week an increase. In the past week, we've had 44 additional cases of COVID-19 in Eau Claire County, about an average of 6 cases a day. Again, our goal continues to be to keep that number as low as possible, not only for the public health capacity to not be stretched and for us to make sure that we are talking to people about staying home and not spreading from that positive case, but also really to make sure that we are staying steady with disease spread or decreasing that over time in Eau Claire County. It's really good news that we're at that about 6 cases a day and have been at that for this week. I do want you to know that the last couple of days, our case numbers have been up. So we're watching that very carefully, especially given the news from Minnesota and surrounding states that they're seeing increasing case numbers again. Also, especially with the news that the variant strain is spreading. So we hope there's not a different story next week. We are cautiously very pleased with the numbers, but do know the last couple of days, we have seen some increased case numbers that we'll talk about more next week. We have an estimated 70 individuals that are in that group that is tested positive that we are actively working with and their close contacts to make sure that they understand the importance of staying home and not potentially spreading COVID-19 to others. 371 Eau Claire County residents have been hospitalized since the start of the pandemic, an increase of 4 people since last week. And we are at 105 individuals in Eau Claire County that have died related to COVID-19. Again, that reminder that the state data continues to be cleaned. So if you are watching our daily numbers, it may be a bit odd at different points as they are looking at that. It's a very big data set. An example this week is that they looked at all of our negative case numbers, and those were cleaned through and made sure that there weren't any errors in the large state data set related to the negative tests. But again, no overall trend changes, no big changes in what we understand about disease progression in Wisconsin or in Eau Claire. It's just some small changes to the overall picture in the last 6 months or so. So a couple of additional data points that we typically share. Our UW-Eau Claire cases remain at about 13% of the total cases. Since September, they continue to do testing, both of symptomatic individuals connected to UW-Eau Claire, as well as their antigen testing. We are now having 19 public health investigations in Eau Claire County. Generally, this number has been going down, but do know we continue to work with all kinds of work sites, educational institutions, and others as we identify cases and trying to make sure that in those workplace settings and in those settings that we are not having spread of COVID-19. State rating for COVID-19 remains at high. That activity level remains high. We also, again, have a flat trajectory. Those are two data points that we are watching. They're critically important to make sure that our activity is not increasing and that it is staying as flat or going down as much as possible. Good news that we remain not increasing with our high activity. We're hoping to get that to moderate soon, but also that the trajectory is flat. Positivity rate is at 3.2%. Again, steady from last week. We continue to encourage anybody that needs a test to get a test. That includes those people that are symptomatic and individuals that come in close contact with either people they don't know the status of their, whether or not they're COVID positive, or people that know they've been in contact with someone that is COVID positive. Please get tested. Our testing numbers are continuing to trend downwards. We're now at 281 tests per day. Regional hospital capacity has been good for inpatient beds. That remains at green. Slightly worse for ICU beds, not related to COVID-19 that we understand, but that ICU bed capacity is in yellow. Community spread is now at 51% this week. That is an increase from previous weeks. It's highest that it's been since we started reporting this in June. Certainly we're watching that. It does mean that when we talk to people that are positive cases, that the majority of people at this point are saying to us that they don't know where they got COVID-19. It wasn't from a family member or a close contact that they are aware of. Vaccination levels, again, are something that we are regularly looking at, and I'll share that in a minute. Our overall vaccination rates, we've moved from red to yellow because it's really a measure that many people have the ability to get vaccinated now because of the move in the state eligibility requirements, and we'll talk again about that in a little bit. We still have limited vaccine available. There's not enough vaccine for every single person that is eligible to get it in Eau Claire County, so it remains in yellow, but many, many more people are currently eligible. For all of those measures, all of the data points that we share with you every week, please do go to our website. There's good information there with all of these data points. Again, that is covid19eauclaire.org. State data, we are now at 574,436 individuals that have tested positive for COVID-19. State activity level also remains high, and we now have 6,599 individuals that have died related to COVID-19. At this point in the pandemic, we, in future media updates, likely won't be sharing that state data anymore. Certainly, it's widely available on the state website, and we'll continue to focus on our local data as we move forward. A couple of things to share with you at this point. First of all, we want to acknowledge that it's now been over a year since we've had the first case of COVID-19 in Eau Claire. We're all tired. We're tired of not being kind of at a normal spot, that we're not seeing friends or family or coworkers in the same way. We're staring at a computer screen a whole lot more for those of us that are in employment situations where we interact with one another. We're tired of distance and having to pay attention to some of those things. I'm tired of that as well. With lower case numbers and with vaccination, we have a lot of hope. And some people may be starting to think, yeah, we're done. We don't need to be cautious anymore. More and more experts are clear that while that hope is there, and why we at a local level, at a state level, and CDC at a federal level are talking a lot about hope, We know that we are not in a place where we can throw caution to the wind, where we can say that there isn't risk. We aren't out of the woods yet. In part, we still have a lot of high-risk people that have not been able to get vaccinated. While our vaccination rates are high in Eau Claire, there are still many, many, many people that have not gotten 2 doses of vaccine and are fully protected. Those people are at risk. We also know that until we get vaccination rates up and until we have good coverage, the risk of a mutating virus is higher and higher as a concern that we all need to have. We see this in the national media, and I know many of you have seen it, but it's true in Eau Claire as well, that our best protection is to get vaccination rates up quickly in order to prevent the variant strain of COVID-19 really having an enormous impact here. So again, the more that we have cases and spread of disease because of what we are doing, if we are deciding not to do the basic mitigation strategies, the more risk we have for the variant strain and the more risk we have for challenges down the road. At this stage, we need to keep our case numbers low. We want to make sure people are not getting COVID-19, that we don't have more deaths. Again, it's about slowing this down. It is also about continuing to find ways to do things that all of us really want to do, myself included. Our message continues to be that as we get vaccination into arms and we get our vaccination rates up, it'll be more and more possible to do that. We know if we get vaccines in, they're effective. And right now, the research is showing that there aren't variant strain outbreaks once a good population of people is vaccinated. We also do want to let people know that reinfection is a real possibility in our state and across the nation. And it is something that we are trying to track closely. It has happened in Eau Claire. In the first 12 weeks of this year in Eau Claire County, we've had more than 30 suspect reinfection cases in our county. Those are not in our case numbers because reinfection really by definition means that somebody has another positive COVID-19 test who previously had a positive. And if it's outside the window of when it could be most likely considered continued shedding of that same initial infection, it is considered a suspect reinfection. We're still learning more about that. It is very difficult to determine by CDC and by the state lab when we know that it is a true new reinfection. But we definitely have cases here that we are following that up with. It's wonderful to know that our case numbers are low, but we also can't risk having people get reinfected because of not following mitigation strategies and really having challenges with that. So about vaccination, that's probably our biggest update and topic that will be in place moving forward. It continues to be a critically important effort, not only by our health department, but by all of our community partners that are leaning in hard to vaccination. Our vaccination rates are really solidly good, and that's because of that really important partnership. Our pharmacies, our healthcare partners, and the health department are working hard to make sure that we can find every way possible to get as many vaccines in arms in Eau Claire County as we can. And I really give enormous credit to the work that is happening across the community to make that happen. The state did just announce on a call that I just got off of a few minutes ago that this week our state vaccination numbers per day are the highest that they have been since the start of vaccination. So we are ramping up statewide vaccination numbers every day, and we have the highest numbers of vaccines provided in the last couple of days that we've had in any other part of our vaccination efforts. If we can keep that up, and if we can keep vaccine supply high in Wisconsin, we really will hopefully move as quickly as possible forward out of this pandemic. So something to celebrate. A couple of reminders about vaccination. Newly eligible as of Monday of this week were people with certain health conditions. Again, those people are newly eligible because those conditions put them at higher risk of hospitalization and death related to COVID-19. If you aren't sure if you are eligible, please go to our website, covid19eauclair.org, look at the vaccine appointment button and tab, and there is a lot of information there to help you navigate whether you are currently eligible for a COVID-19 vaccine. It'll walk you through who is eligible. It'll walk you through all of the locations where you can schedule a vaccine dose and an appointment. There are many options in Eau Claire County. If you see your healthcare entity listed, if you are a Mayo patient, if you are a Prevea patient, if you are a Marshfield patient, for example, please click on one of those tabs to be directed to how their system is handling vaccination. It's a quicker way to connect with those systems rather than calling your individual healthcare provider. That will walk through what the process is within those systems. If you have questions about this after you go to those links and click on that button and either use the phone number to call or the electronic link to link to an appointment, please don't worry about calling us. You can call them if you have a number, but you could also call the call center number. That's 715-831-7425. We also, again, really ask everybody to make one appointment. We know many are anxious to get an appointment as early as possible. Once you make an appointment, please keep it. It is difficult on all of our vaccine providers if they have no-shows. It means that they have an appointment that is empty when they could have given it to someone else in the community. And all of us want to make sure that all of those appointments are filled with people that are showing up. If you were in a group that was previously eligible, such as those over the age of 65 or eligible because of an employment category, please know that we want you to get a vaccine as well. Same process, go to the website, click on that vaccine appointment button, and it will walk through for you how to get a vaccination. We really want you to take the opportunity to protect yourself and those around you. If you're over the age of 65, remember, a vaccine is really one of those ways that it is really much safer to visit with those you love once you're vaccinated. So really, we encourage you to reach out to your friends and family that are over the age of 65. And if you are and you have not yet gotten vaccinated, please make that appointment. If you have been on a waiting list and you are currently eligible to be vaccinated and you have not heard from the entity where you put your name on a waiting list, please reach out to that entity or call our call center number and we will help you navigate. We do not want people waiting that are in that 65-year-old or older age group, particularly that group, to get a vaccine. You are prioritized before the other groups, and we want you to get vaccinated. Another reminder is that vaccine is free. Getting the COVID-19 vaccination is at no out-of-pocket cost for the individual that is getting vaccinated. We want this message to be clear and simple for everybody in Eau Claire County. Getting a COVID-19 vaccine wherever you go should be at no out-of-pocket cost to you. You may have, if you have health insurance, be asked for your insurance card. If you do not have health insurance and you get asked for an insurance card, you simply say, I don't have health insurance. You still get a vaccine. If you're asked for your insurance card, the reason for that is that the insurance company is billed for an administration fee by some of our local providers of vaccine in order to recoup some of the cost of administering the vaccine. That cost cannot come back to you as an individual. So even if it's charged to your health insurance, the cost for that does not come back to the individual. Again, we want this to not be a barrier. We don't want there to be a message in the community that there is a cost or there's a requirement to have a health insurance card. If you're having any issues or concerns, please call our call center number and talk that through with that team of people. We want to be really clear that this should not be a barrier to you getting vaccine. So the good news about vaccination is that 50,457 total doses of vaccine have been given to Eau Claire County residents, an increase of more than 8,000 doses since last week. Again, I think you may remember previously we were at that 3,000 to 4,000 doses a week. We did up that slightly, but this is a significant increase in the volume of doses in the past week since last week, Thursday, that were given to Eau Claire County residents. 30,935 individuals have gotten at least one dose of vaccine. We're almost at 30% of our total county population that has gotten at least one dose of protection against COVID-19. And we're now at more than 21,000 people, about 20% of our population in Eau Claire County, that has completed the entire series for COVID-19 protection. 65% of our 65 and older have completed that series, and 77.5% have at least one dose. Again, our most at-risk population is really getting protected in a way that's important. Do know that we still want to make sure that our 65 and older population and the rest of our community continues to get vaccinated for COVID-19. So we are doing well, and we still have a long ways to go. The state has indicated that they expect everyone over the age of 16 to be eligible to be vaccinated on or before May 1st. So we're looking forward to that date where all of our clinics are open and we have sufficient vaccine for anybody that wants a vaccine, and we hope that's everybody to come in and get vaccinated. Vaccine supply is increasing. We heard again today from the state that our volume of vaccine progressively is increasing coming into the state, both via the federal direct program that goes to pharmacies, and that includes in Eau Claire County Walgreens at the moment. We understand that that will likely increase, and we will have federal allocations also to entities such as Walmart and CVS and other pharmacies in Eau Claire County. Yet this week, we don't know when exactly that will happen, but it's good news that federal direct allocations are coming in to the state. We also know that starting on April 8th, we will have a Fema site, a Federal Emergency Management Vaccination site at UW Eau Claire at Zorn Arena. We talked about this last week. We'll start with 700 doses a day at that 5-day-a-week location for 3,500 doses provided at that one location per week. And that's, again, really good news for the volume of vaccine that hopefully we'll be able to be giving in the next couple of weeks in Eau Claire County. This FEMA site will be an asset not just to Eau Claire, but to our region as a whole. Again, a reminder that that clinic is for the region as a whole to have easy access in a simple way at a set site 5 days a week. Appointments aren't yet available for that FEMA location. As soon as we have them available, we will be announcing that broadly, and they will be on our website at that same vaccine tab that I indicated earlier. We also want to let people know that our community expectations document, or the frame for how we are talking about the basic mitigation that we need to keep disease slow in Eau Claire County, that document, as we've said previously, is actively being worked on to be updated. We expect that to be available early next week. That document really will be walking through not only those data points that we think are critically important right now to be watching, and that is our case activity level, which we talk about every week, and our vaccination level, which we are increasingly talking about. And as long as we continue to have a low or flat trajectory with cases, and our vaccination numbers continue to increase, we really see it very possible that by July, we will, as the state has indicated, be in an entirely different place with the kinds of things that we all have been walking through for the last year. So we'll be articulating that more specifically in that document that should come out in the beginning of the week. We'll be sharing that with all of you. So a couple of questions from media that I'll walk through to start, and then we'll move to any questions in the chat. First, how are our local nursing homes doing? Are they progressing in a way that we would have hoped given vaccination happening? Should nursing homes with residents and staff that are vaccinated be able to relax any of the protocols that have been in place? And if so, how could that happen? And when could we again expect to have visits happening in our long-term care facilities? So first of all, we have had really an amazing level of work happening in getting people in our long-term care facilities vaccinated, both staff and residents. And really kudos to our long-term care facilities in Eau Claire. They have done an enormous amount of work to facilitate getting those vaccinations to happen, again, with federal pharmacy partners, Walgreens in specific, but other partners as well. We have been having many fewer cases in residents and staff since our vaccination levels have gone up significantly in those locations. Primarily, those cases have been with staff when we have had them. And again, we are working hard to make sure all staff see the opportunities and get vaccinated as quickly as possible. In conjunction with CDC, our federal partners did issue revised visitation guidance for nursing homes on the 10th of March, so a couple of weeks ago now. That revised guidance from the federal government, which is what is followed in Wisconsin for nursing homes. The Center for Medicaid Services is the overseeing agency for all long-term care facilities, skilled nursing facilities in our state. That guidance said that all facilities should allow for indoor visitation for all residents. So again, regardless of vaccination status, except in a few small circumstances when there is an outbreak or there are high levels of disease happening in a specific nursing home, there continues to be core principles that need to be followed, and visitation is encouraged for residents in those facilities. There's more information available at the state and federal websites about this. All of our skilled nursing facilities, our long-term care facilities, are aware of this guidance and have been moving forward with that. Again, it's important to remember that anybody that has a loved one in a skilled nursing facility needs to follow some basic practices so we keep everybody protected. That includes making sure that you're not going to those facilities if you have any symptoms, making sure that you're washing your hands, you're wearing a face covering at all times when you're there, you're keeping distance. That 6 feet is critically important. At those facilities, they need to keep signs up, they need to keep their cleaning and disinfecting in place, they need to make sure that their staff are wearing the appropriate personal protective equipment or PPE, and that they really make sure that ill residents are kept separate from those that are not having COVID-19. So there are continued framework for how skilled nursing facilities and long-term care facilities are really operating given COVID-19 and the risk. They do continue with testing, and there has been a federal change related to visitation. So again, talk to your nursing homes and get the information directly from them about their processes and policies. It's important to work with the nursing home. They are doing a lot of work to keep things safe for the residents, but also move forward with vaccination, with their processes for visitation. They need to make sure that they meet all the guidelines and find ways to get visitors to come in. They can set timeframes, and they likely have, but they really want to work with all of you to make sure that people can visit. An additional question from media: could you provide an update on flu hospitalizations now that we're winding down toward the end of flu season? Would you say we've successfully avoided the twindemic, as put in the question? that we were concerned about. We have seen no hospitalizations for influenza in Eau Claire County this flu season. That is really, really good news. Typically, we average about 70 influenza hospitalizations a year, and that is an average over the last several years. Generally, we don't see any cases after May. So as stated, this is the flu season, and we will likely potentially see cases up to that May timeframe or so. But really, all of those basic mitigation strategies that have helped support having lower case numbers recently have also supported keeping influenza cases really non-existent as hospitalized cases. So yes, masking, distancing, people not gathering has helped incredibly. So a question from media, what would you say to people who are resuming pre-pandemic habits like going to large parties or big gatherings? Is there a possibility of another surge here in Eau Claire County, even though vaccination is ramping up? Again, as I said earlier, this isn't the time to throw all precaution out the window. Yes, we are getting people vaccinated, but yes, we are still at a place where we don't have herd immunity. We need to be cautious. Very large social gatherings are not a recommendation of the federal government, of CDC, or of the state, or of our local health department. In all cases, we are saying small social gatherings. Those people that are vaccinated, again, in those private gatherings, vaccinated people together is less of a risk, and that's been shared previously. But again, with variant strain and low vaccination rates still, we need people to follow those basic strategies. Large parties, large gatherings are not recommended. Does the state health department have any, does the local health department have any new information on the upcoming Fema site? I think we walked through that. I would just add that, again, we are going to be operating 5 days a week, 700 doses a day for 3,500 a week as a starting point. It is a partnership between UW Eau Claire, and I really want to call out all the hard work that they are doing on having a site that is going to be ready to go in a couple of weeks, and our partnership with Fema as well. More information will be coming on the details of the site. We expect it to be a Tuesday through Saturday operation. With the majority of Wisconsinites now eligible for vaccine, how important is it that people remember they're not fully protected until 2 weeks after their second dose if they receive Pfizer or Moderna, was the question. Again, no matter which vaccine you get, J&J or the Janssen vaccine, the Pfizer or the Moderna vaccine, it takes some time for that vaccine to build up in your system. That 2 weeks is needed for all of those vaccines in order to be fully protected. Again, the protection with the vaccines that we have now and the data that we have now is 100% effective against hospitalization and death. So 100% protection is what we are going for, and that 2-week window is needed. Even at that time, again, protection is wonderful for that individual, but not everybody is vaccinated. Anybody under the age of 16 can't get vaccinated, and that's 20% of our population. So again, vaccination critically important. It will make an enormous difference to that individual. And at a community level, we need to keep paying attention to really following those basic strategies to prevent rapid spread of disease. We need to protect those people that are vulnerable around us. Again, a reminder from CDC and from the state, if you're fully vaccinated, gathering indoors with other fully vaccinated people in those social private settings is something you can do. Grandmothers with grandchildren is something that I know my mother is looking forward to once my children can be vaccinated. She is now really happy to meet with her friends that are her age and fully vaccinated and able to do that kind of, again, in private gatherings, meet together. If you're in public, wear a mask, visit with only Make sure that you are really being cautious about any connection you have with people that are higher risk. Avoid large gatherings and still delay travel whenever it is possible. So with that, Audrey, do we have any additional questions?
Yeah, some follow-up questions about reinfection. Can you say for those who are those suspected reinfection cases, if the second infection was generally more or less severe than the first? And can you say about how far apart positive tests have to be considered a possible reinfection?
So there's a couple of things wrapped up in that question. Again, we don't have data that we keep on severity of illness, except hospitalization or death data, and that's obviously the far end of that severity continuum. I can find out a little bit more about what we're anecdotally seeing with our disease investigators, but I don't have that information right now. Again, following infection, there's a 90-day window that we wouldn't include any positive test in that window as a new infection or a reinfection, a suspect reinfection. So that 90-day window right now is the window being used at a federal and state level to really name when we are concerned about the potential of a reinfection with a new positive test because of symptoms. Any other questions?
None in the chat box. Would anyone like to unmute and ask directly?
All right. We will be back next week, Thursday, April 1st. I see that it is next week, Thursday, so not. We will still share all the basic and upfront information for you. We won't pull any April Fool's jokes, or hopefully that will not happen in my messaging that is given to me. But you have our commitment. We'll be back next Thursday with all of the basic information and data that we share on a weekly basis. Please go to our website, covid19eauclair.org, to get a really full picture of what's happening in Eau Claire, as well as really good resources for doing the things that you need to do in this community. If you have questions, the call center number is 715-831-7425. Thank you.